and I'm doing well, finally.
Coordinated care planning is about putting the patient at the center of the care. It's about bringing together traditional partners and non-traditional partners to make sure that we meet the needs of the patients.
Before the plan, I was falling all over. I was really sick.
My mother was in a very bad place. She was in and out of the hospitals, I would say once a week. And if she wasn't, she was basically almost comatose in her bedroom.
For the most part, patients don't want to come to a hospital. Patients want to stay in their home, and I think this gives us the opportunity to allow them to stay in their home and bring the services to them.
When you leave the hospital like that and you're feeling still sick, you need someone.
There was no monitoring, right? There was nobody following up on the blood work, nobody following up on all the tests with the specialists. Once we were able to link up with the doctor and all together with the nurse, the rapid response nurse, the PT, the physio, and all sit together and everybody was on the same page. The patient was the center of our care plan. Once we were able to do that, then we were able to work for the patient.
And they get that coordinated care so that everybody knows what's going on and how their needs are being met by the other players. When there's more than one player on a team, you need to know what the other person's doing.
Safety, mobility, medications, health, breathing, blood pressure, all that stuff. It's all covered by different disciplines, different service providers. And that's why it's important that we're all kind of doing the same thing.
I think it's a great partnership, and I think this is something that as a community we need to continue doing. We need to continue looking at all of the different partners and what our role can be to help these clients that are struggling. There's so much suffering going on that we need to address, as well as the financial burden to healthcare.
You can tell how well she's doing. The difference in her is astounding. It's so wonderful to see how well she's doing. Then you can see the system works.
She's all put together, she's well kept, she looks happier.
I'm doing so well now.
She's regained her independence, her joy for life, the smile on her face. It's just, they were a tremendous help. They were.
I'd like to say thank you very much for all the help they did, and I think it's great.